Well, welcome back, everyone. It is Wellness Wednesday, and we're going to talk about the difference between heart attack and stroke. And here to discuss that with us is Valarie Balsard. She's the interventional neurology physician assistant, as well as Gerri and she's a cardiology nurse practitioner. So welcome, ladies.
Thank you.
All right, so Valarie, let's start with you, okay? All right, so when it comes to signs of a heart attack or a stroke, they can kind of be similar, I guess, So can you explain the key differences in the symptoms of those?
Yeah, so when we think of a heart attack, we have some classic symptoms. We think of things like chest pain or pressure, shortness of breath. Sometimes people get pain down an arm or up the side of their jaw. When we think about stroke, we think of sudden onset of symptoms that happen on one side of the body. So things like numbness, weakness, facial droop, some speech difficulty. We even have an acronym, we call it the BFAST symptoms. B stands for balance or coordination. E stands for vision, eyes, so visual deficits. F stands for face, facial droop. A is for the arms, for weakness or numbness. S stands for speech, and T means it's time to call 911.
Okay, so, it's important to recognize those differences, I guess, very quickly, but the treatments are also different as well, right?
Yes, they are. So even though that we're dealing with usually the loss of blood flow through a vessel, either to the brain for either a clot situation or from an actual rupture of a vessel that disrupts then flow and causes bleeding in the brain, or that there's disruption of flow to the through the coronary arteries due to a clot that then deprives the heart muscle of blood and oxygen, the treatment teams are different that affect that. So that's the key thing in differentiating what is going on with the patient, because even though they're both going to come to the hospital, hopefully in a very timely manner, we need to know what's going on with them so that we have the right treatment team there so that they can provide the appropriate care in the most timely manner.
Yeah. So sometimes, if you're experiencing those symptoms, you might panic, and one of the first things that people reach for is aspirin, but that may not be the wise decision, right?
Yeah, that's true. Whenever we talk about strokes, we have two types. We have ischemic stroke, which is what most people tend to think of, and that is where blood flow isn't getting to an area of the brain appropriately. Or we have a hemorrhagic stroke, and that means blood is actually leaking outside of the vessel and moving to an area it shouldn't be. The only way to differentiate the two is with imaging. And so if you take an aspirin while you're having a hemorrhagic stroke, it can actually make things worse.
Okay, so, someone is finding those symptoms, they're experiencing those, what should they do,
They need to just call 911.
Yeah.
That is the best option. Some people will try to stay home, wait it out a little bit. Remember that if you truly are having a heart attack or a stroke, the longer that you wait, the more damage and potential threat to your actual life is going to happen. Calling 911 gets you help immediately when that squad arrives. They also provide treatment on the way in, and then they can communicate with the hospital to make sure that the appropriate team is there and waiting on you to not delay care once you get there.
Yeah. Now, I understand St. Rita's is the only comprehensive stroke center in the region, which is kind of amazing. So what does that mean for the patients, especially in severe or complex cases?
Yeah, this is a fantastic asset for patients. This means that we're equipped to deal with all types of strokes, both ischemic, hemorrhagic, and the more complicated cases like aneurysm ruptures. So having this access in this area means treatment can happen faster. And when we talk about either strokes or heart attacks, quick treatment is the best thing for patient outcome.
Yeah, so sometimes we hear the phrases time is heart or time is brain. Can you explain that?
Sure. All of our cells in our body are oxygen dependent, and so we need blood flow to provide oxygen and nutrients to keep everything healthy and functioning as it should be. When that flow is disrupted by a clot or by a rupture of a vessel, then that flow of oxygen-rich blood and nutrient delivery is interrupted. And for every second that that's interrupted, the cells begin to dysfunction, and then that dysfunction rapidly progresses to injury and then to death. And once the cell dies, there's no bringing it back. And so the longer we wait, the greater the chance of a larger area of not only injury, but cell death.
Yeah, so I really appreciate you coming on today, kind of explaining the difference between, the symptoms and what happens between heart attack and stroke. And it's so important for our viewers to know. So thank you so much.
Thank you for having us.
All right, well, don't go away because we have more when we return.